Hey everybody, welcome back to today's lesson on hemodynamics. This lesson focuses on the venous system, particularly the structure of veins, their normal function, venous flow characteristics, their adaptation to increased inflow, and the impact of respiration on venous hemodynamics. Veins play a critical role in the circulatory system by transporting deoxygenated blood back to the heart. Unlike arteries into which the heart pumps blood directly, veins operate in a low-pressure system and rely on several physiological mechanisms to maintain effective blood flow. Veins are capacitance vessels, which means they can expand and store large volumes of blood with minimal pressure changes. This is because of the structure of the wall of the vein, which consists of three layers: tunica intima, tunica media, and tunica adventitia, as well as valves within the tunica intima of most veins. The tunica intima is the innermost layer made up of smooth endothelial cells which minimize resistance to blood flow. This smooth lining minimizes turbulence in venous flow, which is particularly important in veins where lower pressure and slower flow increase the risk of clotting. The tunica media is the middle layer with a relatively thin band of smooth muscle, significantly thinner than in arteries. This allows veins to stretch easily to accommodate changes in blood volume and contributes to venoconstriction, which reduces the diameter of the vein, increasing venous return to the heart. The tunica adventitia is the outermost layer, consisting of connective tissue that provides structural support and flexibility. Additionally, most veins contain valves, which are extensions of the tunica intima. These valves prevent retrograde or reverse blood flow by closing with changes in blood pressure. This ensures movement of blood toward the heart. Under normal conditions, veins operate at a much lower pressure than arteries. The function of veins is to return blood to the heart, and their shape is highly dependent on the amount of pressure exerted on the vessel walls. When venous pressure is low, veins are more hourglass-shaped rather than a round shape. When venous inflow increases, like during exercise or when the sympathetic nervous system is triggered, veins change from an hourglass shape to oval-shaped, then to round-shaped. This allows veins to compensate for the volume increase without a large change in pressure. The ability of veins to alter their shape with minimal pressure changes is a key physiological feature that aids in maintaining stable circulation. Venous blood flow is governed by several hemodynamic principles that distinguish it from arterial circulation. First, the venous system is a low-pressure, low-velocity system. Because veins transport blood under lower pressure, flow is slower in the venous system than it is in the arterial system. Second, since veins lack the strong pulsatile force present in arteries, they depend on external mechanisms to facilitate blood flow, such as skeletal muscle pump, respiratory pump, and venous valves. Blood flow in the venous system typically does not require additional pressure from the cardiac cycle and is non-pulsatile except near the heart. The skeletal muscle pump consists of contractions of surrounding muscles which compress veins, pushing blood toward the heart. The respiratory pump occurs during both our inhale and exhale, or inspiration and expiration. Remember, blood flows from areas of high pressure to areas of low pressure. Upon inspiration, intrathoracic pressure, the pressure within the thoracic cavity, decreases as the diaphragm moves downward, which causes an increase in venous return to the heart from the upper extremities and head. Intra-abdominal pressure increases, which momentarily reduces venous return from the lower extremities. Upon expiration, intrathoracic pressure increases as the diaphragm moves upward, reducing venous return from the upper extremities. Intra-abdominal pressure decreases, allowing increased venous return from the lower extremities. Another way of thinking about this is that the downward movement of the diaphragm decreases venous return from the legs, but increases venous return from the upper extremities, head, and neck back to the heart. Upward movement of the diaphragm increases venous return from the legs and abdomen back to the heart, but decreases venous return from the upper extremities, head, and neck. Finally, venous valves help to prevent retrograde flow and work with skeletal muscle pump to return blood to the heart. These valves open when blood flows toward the heart and close immediately when blood flow slows or gravity pulls blood downward. This ensures unidirectional blood flow, which helps the body maintain adequate circulation. If valves fail, blood can flow backward, leading to varicose veins, among other pathologies. During skeletal muscle pump, as muscles contract, they compress adjacent veins. This compression forces blood upward, opening the upstream valve while the downstream valve closes, preventing reflux. When the muscles relax, the upstream valve closes and the downstream valve opens to allow the next segment of blood to move forward. Understanding normal venous hemodynamics is essential for assessing cardiac function in our patients and detecting life-threatening conditions like deep vein thrombosis. Let's check your understanding. Which of the following best describes the adaptation of veins to increased blood inflow? A. Veins become more elliptical to accommodate greater blood volume. B. Veins maintain a fixed shape regardless of blood volume changes. C. Veins become more circular, allowing for increased volume without significant pressure rise. D. Veins constrict to limit blood inflow under normal conditions. Take a second to figure it out on your own. The correct answer is C. Veins become more circular, allowing for increased volume without significant pressure rise. This adaptation allows them to handle more blood without a significant increase in pressure, which is essential for maintaining efficient venous return and cardiac output. In summary, veins play a critical role in the circulatory system by transporting deoxygenated blood back to the heart. Veins operate in a low-pressure system and rely on several physiological mechanisms to maintain effective blood flow. Their structure consists of 3 layers: tunica intima, tunica media, and tunica adventitia. Since veins lack the strong pulsatile force present in arteries, they depend on external mechanisms to facilitate blood flow, such as skeletal muscle pump, respiratory pump, and venous valves.